There are two organs in our body that are extremely rich in long-chain omega-3 polyunsaturated fatty acids, our brains and our eyes. The retina, the life-sensitive organ and the backside of our eye, is packed with DHA. This is the light-sensitive cells, rods and cones. They sense the light. Could it be so that if you have too little DHA, you have a poor light vision? Or could it be so that if you increase your DHA intake, you have a better visual function? This has been examined in two areas of life, the newborns and the elderly. The newborns can be checked for visual acuity, the ability to separate lines on a visual acuity test. And this was done in a very famous study, many studies, but one of the most renowned studies is the so-called Diamond study performed here in the US, giving to newborns that had to live from mother's milk substitute, not from breast milk, which is rather rich in DHA, but from breast milk substitutes, which generally does not contain DHA. But they then had two groups, or several groups actually, give them either normal mother's milk substitute without DHA or different increased amounts of DHA in the mother's milk substitutes. And they found, by measuring these kids after 2 years, when they were 2 years old, that those who had added DHA to their mother's milk substitute had a significantly better visual acuity than those who had not added DHA to their mother's milk substitute. And I feel it as an obligation to those who produce mother's milk substitute that they should have DHA added to their product, because it's not only for the kids' eyes, it's also for the kids' brains. Going to the other end of life, vision does not improve through lifetime, it rather deteriorates, as very many of you will know, getting difficulties. And one of the most severe disorders is a so-called age-related macular degeneration, AMD. It's a disorder that causes blindness and is the most frequent or common cause of blindness in older age. And very large studies have found that those who had the highest intake of DHA had the lowest risk of getting AMD. There have been intervention studies also trying to decrease the development of AMD, and some of them have been rather positive. Another disorder is dry eye syndrome, which is a disorder that very many people have, blinking as I'm trying to do that, have dry eye, and they have to drip their eyes with viscous dripping. But the reason for dry eye syndrome is that these small glands in your lids that produce some fatty component that oils your cornea, your eye, does not function sufficiently. Two rather recent and very impressive studies have shown that if you, to these patients, give relatively high dose of DHA and EPA, you improve their dry eye symptoms. That means you lessen their disorder substantially. So the AMD and the dry eye syndrome in the old age are positively influenced by a high intake of EPA and DHA, and in the younger part of life, the visual acuity can be improved by giving DHA to the mothers while pregnant and while lactating, and to those who are given mother's milk substitute to have DHA included in the substitute.